The purpose of our research was to improve the care at end of life of people living with dementia and their carers. We focused on co-designing an integrated model of care that can be rolled out across the coast to improve that care for those people. One of the key components of the research was that we had 4 consumers on the co-design project, which included bereaved carers, as well as people living with dementia.
I became involved in this research because in 2019, my beautiful mum Jen was diagnosed with Alzheimer's and unfortunately lost her battle in 2022. I tried really hard to be there for her at the end of life, and I did everything I could, but I really think that the system needs to do more and we collectively need to do more.
Overall, we ran 7 workshops. We had more than 100 people participate in those workshops, and we set some priorities, which were to look at care coordination, to provide education to health professionals in relation to palliative care and dementia, and improve communication.
The evaluation of the workshops showed that the current model of care is insufficient and that a care coordinator position would be highly beneficial, which has now been rolled out within CCLHD. The role of the care coordinator is to be a one-stop shop to help people living with dementia and their carers navigate the complex healthcare system and take away the burden of just trying to work out what on earth you do next at each stage. For me, it was really fulfilling to see all these different stakeholders come together and actually want to make a difference. And the fact that something has come out of it and things hopefully will still come out of it, I can't ask for anything more.
The CLEAN study focuses on the cleaning and disinfection of shared medical equipment that patients use while they're in hospital. So this could be something from a wheelchair that's used between multiple patients, or the IV stand that's used to administer their medication. And what these all have in common is that they may be shared between multiple patients on a ward or throughout the hospital. And we were focusing on the cleaning of these pieces of equipment to see if we could prevent infections being transmitted across the wards to our patients. The CLEAN study was a randomized controlled clinical trial with a stepped wedged study design, which means that each ward began the intervention at a different stage, which helped us implement the study on 10 wards at Gosford Hospital. The study has actually shown remarkable results. We are quite proud to say that there was a significant reduction in infections during our intervention stage, and that we actually prevented 34.5% of infections within our study wards.
In our study, we estimate that we prevented around 40 to 50 major infections occurring during that study period associated with the intervention. That means that patients are getting less infections, which is great for them. It also means there's less bed days accumulated in hospital from patients having to stay in longer because they acquired an infection. So that has the additional benefits for the health service and for the society and the community in which Gosford Hospital is part of. So we know that the findings of this study are translatable because what we know is that it will reduce infections and be cost saving for health services. In short, what it means is not doing this intervention would be costly and would cause harm to patients. So it's a win-win by undertaking this intervention and by translating it to hospitals globally. We're also really excited that the results of this study have been published in the Lancet Infectious Disease, and so we hope that this study will have worldwide benefits for patients across the world.
A little while ago we started up a motor neurone disease clinic on the Central Coast because we felt there was a need for such a clinic, and essentially this project was looking to evaluate whether or not that need had been met, but also whether the need was actually there and whether or not value was found in the clinic from the patients but also the clinicians involved.
Motor neuron disease is classed as a rare disease. We actually have quite a high number of people living in this region with motor neuron disease compared to other parts of the country. The study demonstrated that this is something that a clinic like this can actually optimise care for people living with motor neuron disease. Also, it's really important to provide equitable care when a lot of care funding is provided in relation to age rather than actual disability.
The patients are very supportive of the clinic. We get a lot of formal and informal feedback about how they feel listened to, the care that they receive is personalised. They like the fact that all the clinicians are present together and can problem solve issues at the time. And I think the clinicians feel the same. Prior to the clinic, no one really knew who was looking after each patient. No one knew how to talk to each other and solve problems. Referrals for next stages were quite fragmented, and that's all been streamlined through the clinic as well.
What the research has really highlighted that there is lots of work that needs to be done to integrate care, to overcome many of the fragmented services and systems that we have to navigate. But we are hoping with the information that we've gathered that we can actually raise awareness and help to guide the future of the clinic. We're highlighting a model of care that can actually help other diagnostic groups. Many people in rural and regional areas are facing the same issues about how do we manage and coordinate care for people living with MND.